Hi, I'm Dr. Rasya Dixit. I'm a practicing dermatologist who has been in private practice in Bangalore from the last 15 years. One of the most common hair things that we are doing nowadays is coloring our hair. This could be just to cover the grays, or as even younger people do it, as a fashion statement. So when we understand hair coloring and hair fall after hair coloring, we need to understand how the chemical process of hair color actually is happening. So when a hair color has to enter into the hair shaft, the cuticles have to be loosened a little bit so that the pigment can enter into the cuticle. Then it is sealed with a conditioner. So that is how the hair color enters into the hair follicle. But this process is bound to make the hair shaft weaker. So when people say that we are having hair fall after repeated hair coloring, what they are actually telling is there is a physical and a structural damage to the hair, and the hair shaft is breaking and it is falling off easily. How can you reduce this? One is to reduce the frequency of hair coloring. So if you can avoid coloring your hair and not do it more than say once in 45 days, you would reduce the damage to the shaft. Second is to use as much as possible ammonia free and PPD free hair dyes which are having less damage to the cuticle. Third is to use very good conditioners and shampoos which are meant for colored hair. This prevents the damage to the hair which has been chemically treated. And fourth, to make sure there is no underlying problem which is also contributing to the hair loss, like a polycystic ovary or a thyroid disorder or a vitamin deficiency. So if you are having extreme hair fall after hair coloring, do speak to your dermatologist who can give you recommendation on how to use the correct hair dye which is suited for your hair type, and give you recommendations on the best shampoos as well as recommendations on a diet as well as a vitamin plan.